Contract!
What do we want?
Now!
What do we want?
Contract!
What do we want?
Now!
Everybody scream!
Oh, well, can you hear me now? Good afternoon, Highland residents and Highland community. My name is Kim Carter. I am the Director for Northern California and New Mexico for SEIU, the Committee of Interns and Residents, the Highland Residents Union. Today we gather not only as a union but also as a community. Highland is the single most important public hospital and the only level 1 trauma center in the East Bay. Intern and resident physicians are on the front line of patient care, attending to every person who walks through these doors. We have been in contract negotiations for over 9 months, and Highland is trying to take away crucial tools that help residents do our jobs of providing quality care for this community. Highland should stay focused on taking care of the people who take care of the patients by providing the necessary tools we need to do our jobs. Today we will be hearing from physicians and elected officials who support us. First, we will be hearing from Dr. Marissa Sulaga, an emergency PGY3 resident.
Good afternoon, everyone. I want to thank everyone who's here to support us residents and physicians in training. Highland is such a special place to work, and while many of us are Californians, many of us have traveled across the country to learn the art of medicine here. We are proud to be resident physicians in this hospital and are proud to serve any patient who walks through our doors. We're deeply committed to serving our patients and this community. But in order to continue to serve this community, we need stronger financial and institutional support from our leadership. Our union negotiations have been going on for too long now, and we are at a standstill. At the bargaining table, time and time again, AHS leadership has rejected our patient care fund proposals, which is a $70,000 fund earmarked for resident-driven projects focusing on improving the patient experience. As doctors who are the boots on the ground and spend the most time with patients, we have new and innovative ideas about how we can improve patients' care. This fund has equipped us to provide better, more efficient, and culturally competent care. Another area where we have not been able to make progress at the bargaining table is with respect to the funding of our DEA licenses to prescribe critical medications. DEA licenses are important for prescribing certain drugs that are controlled substances so we can treat severe pain, cancer, and substance use disorders like opioid use disorders. Paying for this license out of pocket costs $700 and is financially burdensome for us as residents. AHS has traditionally provided reimbursement for these licenses that we use in our daily practice. AHS has made it administratively burdensome to apply for and obtain reimbursement for these licenses. It's not news to anyone that costs in the Bay Area are rising. In our contract, what we are asking for is basic livable wages and benefits. It's critical that we as doctors in training are able to take care of ourselves, our children, and our families so that we in turn can focus on providing the best care possible to our patients. We call upon you, AHS, to recognize the value that the Patient Care Fund provides to improving the care of our patients, and we call upon you to recognize our value as physicians in training and to treat us as the hardworking, dedicated members of the Highland family that we are.
Now!
What do we want?
Contract!
When do we want it?
Now!
What do we want?
Contract!
When do we want it?
Now!
What do we want?
Contract!
When do we want it?
Now!
All right, when I say CIR, you say doctors. CIR!
Doctors!
CIR!
Doctors!
CIR!
Doctors!
CIR!
Doctors!
CIR!
Doctors!
CIR!
Doctors!
What do we want?
Contract!
When do we want it?
Now!
What do we want?
Contract!
When do we want it?
Now!
All right.
Make some noise!
Next, we will hear from Dr. Lei Yu, intern from internal medicine.
Good afternoon.
Good afternoon, doctor.
My name is Dr. Lei Yu. I'm a first-year resident in the internal medicine department. I'm proud of all the work that residents physicians have done at this hospital. Our emergency medicine department is consistently one of the best in the country. And that is because doctors here are dedicated to our patients. However, I'm concerned that future residents and interns will be hesitant to come train at Highland Hospital due to Oakland's high cost of living and Alameda County's lack of support. If Alameda Health System wants to continue to attract the best and brightest residents and interns in America, we're going to have to make some changes. We need to make it easier for residents and interns to live in the East Bay. And we can do that by having a strong contract. Our union, SEIU, has presented various proposals to Alameda Health System, and they have rejected many of them, including the Patient Care Fund. Our proposals aimed at securing resident physicians who are the primary caregivers at Highland Hospital from the epidemic that is resident burnout. It is time for Alameda Health System to work with Highland's interns and residents. We care tremendously about our patients, and we want the best and brightest residents to come to Highland and take care of the people of Oakland. But without a fair contract that accounts for our high cost of living, future residents will not be able to choose to work at Highland Hospital. Alameda Health System, please give us a contract that shows that you are not only committed to your resident physicians, but more importantly, committed to the patients of Oakland and Alameda County. Thank you.
I don't know if Alameda has heard you. What do you want?
Contract.
When do we want them?
Now.
What do we want?
Contract.
When do we want them?
Now.
What do we want?
Contract.
When do we want them?
Now.
Who are we, guys?
CIR.
Who are we?
CIR.
Who are we?
CIR.
Who are we?
CIR.
Who are we?
CIR.
All right, make some noise.
I'd like to introduce Dr. Linda Alvarez. She's the CIR National Secretary Treasurer. She came from New York to offer her support to you all.
Good afternoon, guys. So I'm Dr. Linda Alvarez. I'm your CIR National Secretary Treasurer, and I wanted you to know, as well as Alameda Health to know, that you have 16,000 doctors around the country who support you, who believe that this is ridiculous, what is going on, that you guys are so invested in your care that you are just asking for $70,000 to make sure you can provide for your patients. This is ridiculous that they don't respect you as a system, and we are fighting for that because you care about your community, you care about your patients, you care about everything. So guys, I want you to know that CIR as a national organization is behind you 100% in what is going on, and we will keep being loud for you. What do we want?
Contract.
When do we want them?
Now.
What do we want?
Contract.
When do we want them?
Now.
What do we want?
Contract.
When do we want it?
Now.
All right, and our last speaker today is Leah Salavery. She's the Chief of Staff for City Councilwoman Nikki Fortunato Bass's office. Nikki represents this district, the district that Highland Hospital is in. She couldn't be here today, but she sent Leah to offer some words of support for this fight.
Hi everyone, good afternoon. How are you all feeling? It's an honor to be out here today and show our solidarity with all of you folks on the front lines. So again, my name is Leah Azul Salavery. I work for City Council Member Nikki Fortunato Bass in Oakland District 2, which encompasses Highland Hospital. And I'm here on behalf of our office, really just to, again, show support. Councilmember Bass has been a strong union supporter throughout her career, and she is with you all 110%. So I wanted to just read a statement directly from her so you can hear her words directly. As a member of the Oakland City Council representing District 2, which includes Highland Hospital, it is my expectation that our publicly funded healthcare facilities prioritize patient care, safety, and a just work environment for all. Thank you. My father was a physician who immigrated here from the Philippines. Got support from all across the district, that's great. So my father was a physician who immigrated here from the Philippines from his residency, so I understand firsthand how difficult this work is. Our office recently spoke with resident physicians from Highland, represented by the committees of interns and residents, who brought forth concerns surrounding Highland Hospital's bargaining practices. Labor leaders stated in that time that they have never involved an elected official for assistance in negotiating a fair contract. During our conversation, we learned that this year, new labor relations created a hostile bargaining environment, which very much concerned our office. We urge Highland Hospital to work in collaboration with resident physicians to close this contract and focus on continuing to provide the highest quality of care to our most vulnerable communities. These residents and interns work too hard and around the clock to not receive the benefits they deserve.
Heard that.
We are proud to stand in solidarity with you all at Highland Hospital, who are on the front lines of our healthcare system, as you fight for fair working conditions, livable wages, and ensure the highest quality of care for our patients. Thank you.
All right, this Friday we have our next negotiation session, and it would be great if we could pack the room. Everyone that's here today, if you could be there, it would be great if you could come out and support your bargaining team as we continue to fight for a fair contract. The session is at 5:30 in room E3 in the old wing. Additionally, next Wednesday we'll have a town hall meeting where we'll be talking about the legal next steps we take in our fight for a fair contract. We hope to see you there as well. Thank you for coming out today. We will not stop until we win. When we fight, we win. When we fight, we win. When we fight, we win. When we